Okay, hello, my name is Jose Castillo. I'm gonna be doing the validation for the urinary catheter for female. The first thing we do is we verify the order. So we check the patient's record, and the doctor has ordered the insertion of a urinary catheter for a female. And then what we do is we assess for procedure need. So that what that means is we make sure that the patient that we're gonna see actually needs a catheter. Once we confirm those two things, we can go into the next steps. So we go into the patient's room, we perform hand hygiene, we don gloves, we provide the patient with privacy. The way we do identification is we check the patient's wristband, and we usually ask for name and date of birth. In this case, we will tell the patient as part of their education that even though it may be a little uncomfortable, the procedure in general, the insertion of the catheter, that they will not feel any pain, and that very soon the pain they have right now will subside. So we make sure that the patient is in a semi-phallic position, that the bed is secure and locked, the guardrails are up, and what we want to do is we want to assess the patient for perineal cleaning area. We do not want to don sterile gloves and then come to realize that the patient is actually dirty. So we make sure the area is clean. If not, we'll clean it for the patient. And then what we do is we're gonna open the catheterization kit, which is right here in front of us. And the way we do this is we start away from us to the sides, and then towards us. We can adjust it a little bit using the 1-inch border. We can accommodate things inside. The first thing we do is we're going to put the drape between the patient's legs. Like so. Then we're gonna don sterile gloves. I'll put our trays over here. We're going to pour the antiseptic solution onto the cotton balls. This is the antiseptic solution onto the cotton balls. We're also going to prepare the lubricant. Over here where the catheter is. The lubricant. And we're gonna put the syringe into the catheter's port. With the non-dominant hand, we're gonna spread the labia minora right here, to expose the urinary meatus. And then with the dominant hand, we're gonna clean the mucosa with the cotton balls. Downward stroke. Each antiseptic cotton balls. We get rid of them once we use them. Downward motion. Once we do that and we're ready to insert the catheter, we ask the patient to bear down. So while the patient bears down, we insert the catheter into the urethra slowly. The first thing that's going to happen is we're going to see urine. Once we see urine, you can't see me so well. Once we see urine, we insert 1 to 2 inches more. Then we inflate the balloon. You can see it here, it's inflating. We inflate the balloon and gently pull catheter. Then we want to secure that catheter to the patient's thigh. And the drainage system should be below the patient's level of the bed. Make sure the patient is comfortable. And then we're gonna remove the catheter from the patient. So we're gonna attach the syringe to balloon port of catheter and remove the fluid. So now we're gonna take the fluid off from the retention balloon. We make sure the patient is comfortable. Before we do this, we can clamp the port so we can obtain a urine sample. We label it, then we take the catheter out. We make sure the patient is comfortable. And in order to document what we just did, we're gonna make sure the date and time of catheterization. We can say today's date, for example, is September 12th, 2020. The type of catheter we use, we can say it was an indwelling catheter. The urinary output, we can say we took 25 ml of output. The patency, we can say it was clear. The urinary quality, it was clear, no particular odor. The quantity we already expressed, it was like 25 ml. The patient is alert, oriented. The abdominal assessment was good, skin assessment was good. The patient teaching was done before, and the patient response to care was positive. The patient feels so much better. The patient feels no more pain at the moment.